All right, we have Jane Smith, a 44-year-old accountant who's in for cough that won't go away. She's actually had the cough for several years, she reports, but it's been worse in the last 8 days with coughing both day and night and increased sputum production along with that cough. And the sputum has changed from white, which is her usual, to yellow. Reports shortness of breath when she's walking quickly, doing her daily exercise 30 minutes. Says her cough is congested and has increased in severity to about 5 out of 10 over the baseline, and has a history of bronchitis, also has history significant for smoking, 2 packs a day since age 18, so she has a very lengthy smoking history. Family history, non-contributory. Current medications, just a daily multivitamin and Oscal daily. Has a son that lives at home with her, and had a cold, significant history for cold 2 weeks ago with typical URI symptoms, runny nose, sore throat. Denies any recent travel, works as an accountant, so no presumed occupational exposure, denies any allergies other than allergy to sulfa, has some chest pain which she attributes to musculoskeletal pain. And lungs were mild expiratory wheezing in the right posterior lobe, and right upper and middle lobe with rhonchi that clears with a cough. Afebrile, pulse is 76, respiratory rate is 16. Blood pressure is a little high, 146/92. Assessment is likely a recurrence of bronchitis, which she's had previously. I would also want to rule out cough variant asthma or a pneumonia. I think influenza is really unlikely. Also would be pretty unlikely would be a foreign body in an otherwise healthy 44-year-old who doesn't report a history of that sort of thing. Plan, I think it might be a good idea to do a PFT if my clinic has a pulmonary function test to just see what values we've got on that. It might help us lead to a better diagnosis. Chest x-ray, definitely, since we've got some abnormal findings on the chest. Also a treatment with albuterol because she's been coughing the entire time she's been in the clinic. So we'll see if that opens her up at all and see if that helps us also maybe narrow down a diagnosis. You could possibly do a pertussis swab, especially because of the prolonged nature of the cough, although it sounds like it's more of an acute exacerbation in the last 8 days. You could also do a sputum culture, although maybe end up with just all the oral flora and not really anything that's too helpful. And then if she ends up having pneumonia, I would treat with antibiotics. But if the chest film did not show that, then I would not for just bronchitis. Then it would be just supportive treatment, fluids and enough rest and maybe some time off work. But you could order some albuterol for home if that seemed like it was helpful, especially to help her take some before bedtime to help her sleep. And that would be a plan.
What about your patient education and follow-up?
Okay, so patient education, if I send her home with albuterol inhaler, I would teach her how to use an inhaler with a spacer, and then give just guidance for supportive care, drinking enough fluids, getting enough rest, and calling back if her symptoms worsen or if you develop fever or shortness of breath. And then follow-up would just be, I would say probably just a phone follow-up, and then as needed if she's having increasing symptoms, because she just doesn't appear to be super ill.
Okay, all right.